Normally when you fall or get hurt, you develop a bruise. But what if you didn't get bruises, but instead you got bone deposits? It may sound crazy, but it's real. Commonly known as Stone Man Syndrome, FOP is a degenerating disease that slowly ossifies your tendons, ligaments, muscles, and other connective tissues. This is Fibrodysplasia Ossificans Progressiva. FOP is a chronic illness. As you can see in these pictures, there is an abnormal bone growth around the existing bone. This bone is produced by a mutated ACVR1 gene. The ACVR1 gene is what signals the repair system. Because the repair system is now damaged, it gives instructions to repair the damages with bone. Most common signs of FOP in early childhood are malformed big toes, as you can see in this picture. Other signs are short thumbs. More signs include painful nodules or tumor-like swellings on the neck, back, or shoulders. FOP is an autosomal dominant pattern, which means you only need to get the abnormal gene from one parent in order to inherit the disease. One copy of the mutated ACVR1 gene in each cell is sufficient to cause the disorder. Most cases are caused by a new mutation in the gene. These can occur with no history of FOP in the family, and there's less than a 50% chance of inheriting it from an infected parent. FOP can occur in anyone who has the abnormal gene. Many FOP patients may experience the inability to open their mouth, causing speech and eating disabilities. They may also experience breathing difficulties due to extra bone lining their ribcage. The bones can grow anywhere in the body, on any muscle, any ligament, tendon, cartilage, or any other connective tissue. You can see bone growing throughout this person's body. It is common for FOP patients to lose mobility in their legs, neck, and back by early 20s. Fibrodysplasia is fatal by the late 40s from the heart or lung failing from being under pressure from the extra bone. Here you can see as the cells attack the muscles and slowly ossify them and turning them to bone. Unfortunately, because it is so rare, FOP has no cure, but research is being done to try and find a treatment to control bone growth. Medications can, however, relieve some symptoms, like pain and inflammation. Most FOP patients develop an extreme and severe case of scoliosis. Surgery is not performed to remove extra bone because the trauma of invasive surgery generally leads to the growth of even more bone. It is so rare, only 1 in 2 million people have the disease. That is about 700 people right now. And the misdiagnosis rate is over 80%, as the bone growth is commonly diagnosed as a tumor in the early stages. When bone is being generated and deposited, it is known as flare-ups. Symptoms of flare-ups include tissue swelling, joint stiffness, major discomfort, and possibly a low-grade fever. They can last for 6 to 8 weeks and normally are caused by some sort of physical trauma such as falling or a virus as influenza. Extreme pain is commonly felt when the new bone is generated. There are no preventive measures to getting FOP. However, there are ways to limit the amount of bone growth. Avoiding unnecessary intramuscular injections such as immunization and local anesthetics can help reduce the bone growth because these can cause bone growth at the injection site. Good oral hygiene means less dental procedures, therefore less bone growth. Minimize the risk of traumatic injuries. People with FOP should take steps to avoid physical injuries because they may trigger flare-ups of the condition. Because they have limited mobility, they are more prone to tripping or falling and must be extra careful. People with FOP should not stretch the joints or soft tissues of the body, such as tendons, ligaments, or cartilage, because doing so may trigger flare-ups. Because people with FOP should avoid wearing tight clothing, hard buckles or buttons, tight elastics, straps, or body braces, or any item that puts prolonged pressure on the body. Such items may increase the risk of experience of flare-up.